Hi everyone. How's it going? Happy February. Today for our monthly webinar, we're going to be talking about health certificates, and who better to talk about health certificates than Marianne Frank, our guest here, who is the co-founder of OVForm, a website that helps you complete animal health certificates quickly and accurately. She comes from years of veterinary surgery experience and is a passionate product developer as well. I can't wait to hear her flex her expertise on animal health certificates, and I'm looking forward to having an open discussion with her. My name's Daniel. Just to introduce myself, I'm part of a software company called Celeritas Digital. We've been in the animal health industry for about 10 plus years, building custom solutions for animal health companies. Um, and I post these every month. Um, we like to talk about the intersection between animal health and the industry, mixed with technology and how that's rapidly changing the industry. So um, I'm excited to get this on its way. But Marianne Frank, so nice to see you and welcome.
Hi everyone. Hi Daniel. I hope you're having a good day and welcome to those on replay. Please use the chat if I'd like this to be interactive. If you'd like to let me know. I'm just curious, are there any OVs in the audience? Can you write OV in the chat? If there's anyone else, can you let me know what you do? Just so that I can kind of address your specific roles in the talk. Because what we found out is that issuing a animal health certificate is not just the vet doing one thing. There's a whole process. So it starts when a client wants to travel with their pet, and they're going to ring the practice and speak to someone on the client care team, and the process starts and it ends with them crossing the border and going to their destination. So yeah, lots of things happen, and there's some places where it can go wrong. So I am actually going to really focus on the practice side. The form also has its own quirks, as we all know. The OV training and the notes for guidance, the official channels, are actually quite good for the form itself. It's all the stuff around the form. I've been talking to a lot of practices, and this is really where they need help. So um, that's where we're going to start at the end. I'll have some bits and pieces, and we can ask questions about the nitty gritty and the actual details of the rules in the form and stuff. If Yeah, I'll be guided by you as to how you want to do that at the end. Okay. Um, so if anyone doesn't know what an animal health certificate is, it's basically the animals and pets used to travel from UK to the EU on a pet passport. But since Brexit happened, the EU doesn't accept our passports anymore. So now we've got this 10-page, really long form to fill in, and it's a single use. So every time someone wants to travel on holiday with their dog or cat, we get presented with this form that we fill in, and it just takes a really long time to complete. It's really complicated. There's a lot of places where it can go wrong, and we, we've really had a few issues with people at the border. If their form's invalid, if there's an error, there's actually it's quite tricky because it has to be signed with a pen. It's not digital, so they may have to go and find another vet and get it redone. So you can imagine how stressful that can be for us and for them. Um, but we're going to talk today about how to make it very efficient, keep it profitable, and keep everyone happy, including your team. Um, some vets get very stressed about it, and team members, so we don't want that. Because looking at the bigger picture, I don't know how you're finding things, but in the UK, we're having actually quite a tough time in veterinary. Lack of time's perennial. I mean, we always really struggle with having enough time to do things. Vets are feeling stressed. Clients are wanting more than ever. Their demands are going up. And at the same time, this is almost a perfect storm, our costs have gone up. So in the UK, it's now what's coming in is a higher tax on employees. So the business has to pay more tax. The consumables have all gone up with inflation. And at the same time, we're having a cost of living crisis. So what people can afford to spend at the vets has gone down. So this is all affecting team morale as well. We want to do our best, but you know, there's a lot of pressure at the moment. So let's just think about the basics. So our purpose and reason for being in this industry is mainly to improve animal welfare. And as one practice owner told me, we're not travel agents. So how do we keep us perspective? We don't want to leave our patients at the bottom of the mountain while we spend a lot of time and effort climbing this figurative mountain of paperwork. We need to fit in the animal health certificate work. We don't want to compromise on our other work. Otherwise, we don't feel in alignment with our reasons for being vets. So what I've figured out is if we can achieve a balance, then these animal health certificates can actually be a beautiful way to build our relationship with the clients. It can provide a bit of income for the practice. As there's no consumables involved, it's actually like quite profitable if done right, and it doesn't need to be stressful. If we've got a good process in place, it can really knock on and help the practice operate, you know, stress-free. But if we get it wrong, if we can't get the process right, we're actually going to contribute to some of these issues. So we'll dig into this today and find out how this can be done. So we're talking about mastering AHCs and yeah, talking to practices. We've been doing them for 4 years now. So most of the OVs are actually used to doing them. And as I mentioned before, the main issues outside of the form itself. So what we found is if you're not efficient, it can affect profitability, because could your vet be actually doing something else that is more profitable? Client complaints are just a big headache. I mean, they always are, but if we're having miscommunication and errors in the form, it's very, very stressful for the team. And if you're taking 1.5 hours of vet time per certificate, it can really impact what they can do in a day. So we don't want to have them spending that much time. So this part of the talk is going to cover profitability. Are animal health certificates boosting your business or limiting your profits? The top 4 reasons why clients complain about their AHC and what you can do about it, and how to improve your process to achieve an animal health certificate in a single consult. So it's a 15-minute AHC is the goal. Daniel's already introduced me. I'm a vet and an OV. I've been in practice for 20 years. Since becoming a parent, efficiency's been everything to me. I really love a hot drink that's uninterrupted, and I have no desire to finish late or take work home with me. So if I can get things done in an efficient way, I'm all for it. Like most vets, I didn't study all those years to do paperwork. So when Brexit happened, I mean, I live in London, so there's a lot of people travel with their pets from London. It's quite close to France, and with a very diverse cosmopolitan population. So people often take their pets with them when they visit their family in the EU. I just found that it was taking too long. If I had 3 in a day, it was just destroying all my will to live, and
Kıymalı makarna yapsak ne olur la? Kötü olur mu acaba?
I wasn't getting time
Değil
to
misin?
do other things. So we've made OVForm, and this will streamline everything to do with animal health certificates. It was myself. My husband is a software developer, so I convinced him to develop the code, and my brother does the website. So it is actually a little family business, and we were ecstatic because over 700 practices are using us at the moment. I really want to help my colleagues. It brings me great joy when they feedback and say how much using OVForm has decreased their stress, because I know how much of an issue workplace stress is for us. And it's a major reason why vets are leaving the profession. So I'd like to do what I can to help with that. But it's not just the form. As I mentioned, it's a whole process, and I've started developing resources for practices to not just to address the form, but all the processes around it. I've been talking to practices. I've surveyed over 100 of them, what's working, what isn't, and this is basically a summary that I'm going to present. Well, this is an image on a page actually of what I've found out. So we are going to talk about profitability, customer satisfaction and efficiency, but how do we measure those on our surveys? It turns out that there are components that can be measured and derive these qualities. So for instance, profit is the price minus the cost, which in AHCs, there's no consumables, so it's the price minus the staff time. Okay. Customer satisfaction, it could be looked at as value for money, so it's price, but also did the product do what it should do? So the value is a valid document. And efficiency relates to how long did it take, and the quality, because if you make a mistake, it's going to take time to fix. So it's going to affect your efficiency. So all of these are really essential for a good practice process. Your team is central to everything, and it's like two sides of a coin, the process and the team. Because if you have a great process, your team's going to perform well, and this will improve their morale and their job satisfaction. Or if you've got a poor process, there's going to be more complaints, they're going to get stressed, and a downward spiral happens. I will be talking a bit about OVForm because I think this will help. This will just elevate everything else that I'm presenting today. Because I've built this while I've been in practice doing the job, and I know how much it can help. And I've had, there's nothing else really available, so I might as well let you know about it. So just to summarize, we're going to be figuring out if animal health certificates are boosting your profits or holding you back, the top reasons clients complain and what to do, and the 15-minute AHC. So starting off, profitability is really simple. It's price divided by vet hours. If you feel comfortable, like, put it in the chat if you are happy sharing how much you're charging and how long you're giving your vets to do an animal health certificate. So our survey showed that most practices are charging around £250, and they're giving their vets about an hour. So if we look at, is that going to be worth it if you consider maybe if they were doing something else instead. So if they have 15-minute consults, they could have done 4 booster vaccinations. And if those booster vaccinations on average were about £100, the vet could have made £400 an hour doing something routine. It doesn't really add up. But if we improve the process, let's say they do it in half an hour, then it makes more sense, because they're earning a £500 odd equivalent per hour. And if you get it down to 15 minutes, I mean, that's the holy grail, because yeah, then it starts to really make sense for profitability. So yeah, I think it's worth having a look at your own figures and thinking if it's worthwhile, and how do we do that? How do we get a better process? I've got 2 things to suggest. I would, where possible, delegate to your support staff, your client care team. Where can they gather the information, get it ready before the appointment? If you're using OVForm, this is a lot easier, because you can actually get your pet owner to fill in their own animal health certificate by sending them a link. So they can fill in pretty much everything apart from the rabies vaccination details. So you do that, but it saves a whole bunch of time. Now we've discussed profitability, let's explore how to improve client satisfaction and avoid common pitfalls. So I was just wondering if you want to put in the chat, how many complaints did you receive in the last 12 months, and what were they about? I'm just going to go ahead and share what we found in our survey. So the biggest one, 18%, was price. But actually I think it's because it's a free market, you can't really call that a complaint as such, because someone could go shop around and find a cheaper vet if they wanted to. So I'm not going to go into that one. I'd say communication's right up there. That's pretty important. There's 2 parts to this. Either they've been provided with incorrect information by someone on the team, or they just don't understand it. So I think if you can provide a leaflet or something, a clear, concise information, that's going to help a lot. Invalid animal health certificates, at the end I'll go through some tips for that. Using OVForm will prevent a lot of that, but preparation is key. If you are doing the rabies vaccines, you need to ensure that all the vets are recording that they scan the microchip at the time of vaccination. Bear in mind, not all vets are OVs, so they might be vaccinated but not actually doing the AHCs. Make sure they are aware of the requirements. And also, if you look at the data sheet, giving L4, kennel cough, or feline leukemia virus vaccines concurrently on the same day is off license. So just be aware of that. There's another point. I'm going to go a bit more detail later, but if your data sheet says it's valid after 30 days, you need to use that now, not 21 days of validity after vaccination. So yeah, what we need to do is make sure that everyone has access to some information that's easy to read at the front desk, so they can answer questions, just the basics. So, dog, cat, ferret needs a microchip, needs a rabies vaccination. Or you could have the option that there's 1 or 2 people that know what's going on and everyone refers queries to them. I think that works well too. It just depends on your practice, what you're going to do. Having information for the client, a leaflet or an email. You want to make sure they have the information, although it is actually the client's responsibility to find out what they need to know. If it goes wrong, they're going to blame you. So save yourself the hassle and just give them a bit of extra information. Make sure they know what's going on. preparation. So you want to send people a form so they can fill in before the appointment, or a link. You need to make sure they return the form or they complete the link. So I would suggest a checklist that works well. Making sure your OV has everything to hand. We don't want them running around looking for a blue pen in the middle of a consult. And yeah, the demand is variable. It's very seasonal, actually. So in the winter, like right now, it's February, very few people traveling with their pets, but come July, it's going to be a different story. So having a plan so that you're not caught short and you know what your plan is in the high seasons. And we've discussed the rabies vaccination protocol, just making sure there's a good protocol in place and everyone knows what they're doing. So your workflow could look something like this. When someone phones, receptionist adds client to a checklist and sends them a link. Up to you if you take deposits. A lot of the work's done before the appointment, so I think it's valid to take a deposit, but up to you, obviously. The client completes a survey, it's returned, the vet checks it and make sure it's all fine. And so what we want is by the time the appointment comes, it's really straightforward. Everything's done. The form's all printed out. The vet just needs to scan the microchip, stamp and sign everything, and the owner needs to sign their bit as well. You take a copy. So just as smooth as possible. There shouldn't be any surprises. So yeah, if you want more information about OVForm, I'm happy to get on a call. When you sign up, you'll get a link. We can go through. I'm not going to do a demo for you now, but just so you know, it's going to save you a lot of time because you can send the client a link that can fill in their own form. It improves accuracy. We've got checks and warnings if there's any anything that could cause an invalid form, and you can increase profit just through efficiency mainly. We've had some great reviews. This is one practice said they found it just useful. It was quicker and less stressful. Also, we save the information. So if you have someone who travels every year, it will all be saved. So it's very simple to reissue another animal health certificate for them. And yeah, there's some more reviews here. Even if you're used to doing them, I just find it takes off a lot of the mental load of the process. Okay. So Daniel's just asked if there are different forms for each country outside of the EU. Yeah, they fall under AHCs, export health certificates. So every single country will have a different form. OVForm doesn't actually do those yet, but I'm looking at that because I think it's well, it's difficult to know where to start. There's about 2,000 AHCs, but we'll start with we'll ask people what they need and start rolling out a few of the more common countries. So here's Daniel's also put up the link for OVForm. It's www.ovform.com. You can get a free call with me. I will go through everything with you and we can talk about your practice process. I do have some resources if you want information for your client care team, FAQ, things like that. I do have some options. Also, we did a SOP with training progress. So if you want an SOP, standard operating procedure, they've got a nice one you can just edit to suit your practice. Yeah, so that's all the processes, I'm going to cover a few things that have changed recently with the notes for guidance. That gets updated. It was last changed in 2022, but actually in November 2024, there was just a very small change about the rabies vaccinations. So it says that after you vaccinated a dog or a cat, sorry, any species, there's a minimum of 21 days before they can travel, before it's valid. But it's there's the vaccines by Boehringer Ingelheim, they actually have a longer period before they're valid on the data sheet. So all the notes for guidance said is you need to use that one if it's more than 21 days. So if your data sheet says 30 days, then yeah, you'll need to use that instead, but minimum is 21 days as before. So it's only actually applicable if you use that brand. So if you use Boehringer Ingelheim, just check your validity and use it accordingly. Another thing that's changed is the APHA says we need to give pet owners a leaflet. They must have been having problems with people coming back to the UK and not preparing. So for instance, dogs need a tapeworm treatment to come back to the UK from Europe. And that needs to be over 24 hours before they come back. So I think what was happening, people rocking up, no tapeworm treatment, and then they'd have to wait 24 hours. They'd have to go get one and then wait, and then they can only come back to the UK. What most of us have been doing, we've just been asking people, do you know you need to do this? But now we're giving them a leaflet as well. And you say, here's a leaflet. This is what you need to do to come back. So we'll add that. We've added it as be in our next release on OVForm. A link so you can do that, print it easily. I don't know if you've noticed, but the notes for guidance and all the AHCs are now on the training website, not on gov.uk. So you need to go to improve OV and find them there. I'd highly recommend you print out the notes for guidance and use a highlighter and just make sure you've got some reference. You can easy reference while you're in the middle of an appointment if you need to have any issues. You can just check back. Another thing that's coming is Northern Ireland. So at the moment, while technically you do need an animal health certificate to take your pet to Ireland, they are not checking the documents. From June, that changes, and we don't have to do anything really, but the pet owner needs to do a declaration that they can download off the website. So that's coming in. So it's a declaration saying I'm not going to go into the Republic of Ireland. Yeah, it's just to confirm that they're keeping it local and they're not going anywhere else, and a couple of other things. I haven't looked at it in a lot of detail at this point. Okay. So the form itself, I said I would go into like just a few things. Honestly, I think most of this is pretty well laid out in the training and the notes for guidance, but just to remind you, you need to use an ink other than the printed color when you stamp and sign. The biggest reason for failure is putting the date that you scan the microchip before the vaccination date. Because the argument is, after. You need to scan the chip before you vaccinate the animal, otherwise you can't verify the identity of the animal you vaccinated. So if you write in your AHC that you vaccinated it and then you scanned it later, that's going to invalidate. So this has been the biggest thing that's caused invalid forms. I use the rabies vaccination date as default. OVForm does this for you. It's pretty foolproof. Just stick with that. Use the same date. Typos and consistency are also big issues. Make sure you've got the certificate number on each page. The microchip number needs to be the same on the ID table, the rabies vaccination table, tapeworm treatment if valid, if necessary, the written declaration. So it appears a few times. Make sure it's all correct and on the vaccination certificate. And make sure your vaccination dates match the form and the vaccination certificate. So all of the things need to line up, and also obviously scan the microchip, make sure it's the same as what's on the form as what's on the animal. So that's pretty critical. Yeah, the vaccination's always a problem. You are only allowed to sign the animal health certificate once the vaccination, the rabies, is valid. So it's 21 days after the vaccination, and as we discussed, 30 for some brands. Yeah, I find sometimes people just leave it too late. Like they do 21 days before, then expect us to have availability to do the animal health certificate on the day of travel, which is just really tricky. So where possible, encourage them to do it at least a month before. Gives you just a few more days to issue the AHC. Every page needs a page number. You need to have supporting documents for the rabies. It needs to have the word certified copy on and date. Make sure you stamp and sign each page, and any amendments also need a stamp and a signature. Yeah, maybe at the appointment, get the owner just to like check their details, make sure they're spelling the name spelled correctly and things like that. That's always worthwhile. So yeah, it doesn't all need to land on you. I think some responsibility needs to be shared with the pet owner, making sure they give you the correct information as well. I said keep everything in a box. This is what I meant. Just a little list for you there. The checker refers to a it's like a sample AHC. I've made one if anybody wants it. Just make sure you filled in everything, and there's no typos. You can get a colleague to check if you want. But yeah, make sure everything you need's in one place. Interestingly, I was talking about high demand. It's pretty dramatic actually. So in July and August, we have 4 times the volume of April and 8 times the volume of January. And because you have to issue these things 10 days before they travel, you can't really space it out that much. So we need to have a plan. You could have some extra consults available. You could encourage more of your vets to get the OV qualification. There are actually a lot of OVs out there that just have their own little gig where they issue animal health certificates. So you could either refer out to them or ask them to come and visit you. They could issue out of your practice, and your clients will be happy because they like that you've got parking and it's like convenient and familiar. So lots of options there, but I think it's important to have a plan, not just like when someone phones, you say, oh, I don't have any availability, and just drop them. You know, give them an option, have a plan. Okay, are there any questions? Anything on your mind?
I so this largely just started, and hi Rob, sorry, I don't I'm worried I might have cut you off. I know you joined a little bit earlier, so please feel free to ask any questions before me. I've been talking too much for this, and putting too much in the chat. But I was just gonna ask, so this largely started after Brexit, right? You said, but before this, the EHCs were still a big issue still.
Yeah, so before this, we'd do a passport for the EU,
Oh, got it.
and that they could use that for like years. They could just carry on as long as the rabies was up to date. It would be one time exercise, and it was pretty easy to fill in.
And
But
so this,
EHCs we've always had to do those. That's not new, but we don't have to do them very often. It's not something we do day in and day out. It's like the odd person moves to Australia or something like that, and then we deal with it.
but the AHCs now you said are yearly. Like you have to get an annual. If you need it, you have to renew it every year.
It's worse than that. It's single use.
Oh yes, that's what you said. Oh no.
Yeah, that's actually our main that's why it's so onerous for us, because somebody has a house in France and wants to go there twice a year or something like that.
Yeah. And do they get frustrated?
Oh, everyone, this is a thankless task. Nobody wants
I bet.
Nobody's happy.
Yeah.
It's more expensive than the pet passports.
Yeah.
Yeah, because it just takes longer.
Here, let me.
Hi there, all delegates, and thanks very much. My apologies to start with. Whilst I'm not really in practice, I do live on a farm, and I had a lambing to attend to, and so I was late joining in. And I'm also joining in ignorance now, because I didn't get to that part of the presentation. But also maybe not relevant. So, but anyway, enough waffle. I work for a group called Export Certification Limited. We are in a partnership with DEFRA, where we write export health certificates for livestock and meat and semen, genetics, embryos, that sort of thing, for cattle, sheep, and pigs. So part of my role is to write the certificates and the notes for guidance. And so I thought I might sort of join in and listen to anybody that might want to complain. Obviously, we've not probably covered livestock. We've probably covered pets, really. But actually, feedback on notes for guidance in general is probably useful to see if they cover the areas. I get very frustrated trying to tell people that when you're in the field and you're looking to try and field, I mean, in practice. And the notes for guidance says, look at this link for what you've got to sign. And you think, blimey, why couldn't just say it there? Why do I have to go to a link to look it up? And then, especially if you're a large animal vet, you're in practice where maybe you're in a field signing it and you can't actually access Wi-Fi to get to that link. So really, whether it's appropriate, Marianne, you say, but whether there's anybody here that has questions on notes for guidance or any of the sort of writing of certificates that they think is more tricky than they think it should be, and then perhaps why it is.
Yeah, I find actually it's quite confusing at times. Sometimes it's a bit ambiguous. I'm not quite clear on what it's trying to say. But I find if I contact the APHA, they're usually very helpful. Sometimes more than others. Yeah, I don't know. I think it's just not, as a clinical vet, it's just not part of our skill set. I think what comes very naturally to the people that do exports all the time is just quite tough for a regular vet. It's not that clear to us, and then we're just scratching our heads and getting frustrated. The fact that it's still a PDF also is quite strange to me. Like most other documents now are more digitalized. So I think we're heading that way, though.
Yeah, I think we are heading in that direction. I mean, to be honest with you, until 2 years ago, maybe 3, it was all on Crown paper, so it couldn't be sent through an email. It had to be on the official paper sent out from Carlisle in particular, but wherever one's dealing with. So it's always a step moving along with these things, that's for certain. In terms of being ambiguous, I agree. I think, hopefully the notes for guidance are the things certainly that in the large animal sector, we try to concentrate on trying to explain things, because, excuse me, in negotiating the certificates between the two countries, it ends up being a bit of a mishmash of what they want you to write, because that's what they think they want to accept, and what we can certify from the UK. And so trying to get those two in together is quite often a little bit wordy, and gets a bit confusing. And what's more is nobody will accept the same certificate. So in UK ECP, we send out drafts of how we think they should look to the countries we're negotiating with, and they say, oh, no, we have our own draft. We'll send it back to you. You change our draft to what you can do. We don't change your draft. So everyone then takes a different form. So, you could be dealing with Azerbaijan, and it'll be different to Uzbekistan, to Kazakhstan, and they're all next door to each other, but actually they've all wanted it written in their own little style. So yes, it can be confusing. And what's even worse, I think, and perhaps for the vets who are attending, and forgive me, I missed out at the start, but I started in practice in 1988. And one of my first jobs was sending top show jumpers to the US and signing the certificates then. And the practice had no qualms about sending me out in my first week and sending me out there and saying, right, go and do these certificates for this horse to go to America to jump next week. By the way, if it's not right and they haven't got all the right tests, they put the horse down on arrival. They don't give it any benefit of the doubt. But, I didn't worry about it. And I think that the concern now is that, one, there's a little bit more pressure from the Royal College. There's a little bit more pressure from APHA, and there's a little less confidence within the veterinary practices that they're going to do it right, because they haven't been trained to do it. They haven't been encouraged to do it. And therefore, there's a little bit of uncertainty about it. I think my sort of take home there is have confidence that as a vet, you're pretty darn good. You wouldn't have qualified as a vet if you weren't well educated, a good thinker, a good studier. Read at what it says, and if you read what it says, on the whole, you'll be doing it right.
Yeah, Rob, just to feedback a little bit, I think when I look at, and I've looked at other export forms as well, it's taking quite a simple concept, like, let's say a lamb certificate to export lamb is like, basically they want to know if it's chilled, if it's minced or whole. Like there's only a few variables there, but they put it all together in such a complicated way. I think for me, the way my brain works, it's just yeah, I would need somebody to talk me through that, definitely. It could be, I could just see much easier ways of doing it, but I'm hoping that comes through eventually. In the meantime, I'll see if we can streamline it for people. Yeah,
And
it's just it's so interesting that you're on this call. I'm so grateful to meet you, just to get some background there. You've been around a long time, and you've seen all the evolutions.
Yeah, I think I've put my email in the chat. I hope that's showing up there. Probably not ukecp.com. So I don't deal with the meat sections, but there's a gentleman called Martin Williams within the group that does, and certainly he used to be DEFRA. He took sort of civil service pension and changed to the dark side. So he's now with us and a lead on meat products. So if there were queries, I could certainly feed those through to him and say, yeah, this is something that the industry is just questioning. If there's problems like that, I think it's our job to try and ease those things along. If you do things foolishly and recklessly, well, nobody's going to help. But if you've read the notes and it's not clear, then that's our fault, and we can look at how we clarify it, because that's what the notes are for. The official document is the EHC. The notes are there as people in DEFRA and people like myself have written to try and clarify it so that you actually have an easier time of signing it.
That makes sense. I was gonna ask also, Marianne, I know we talked about kind of how the regulations have changed since 2022's update, was it? And then you had mentioned also a 2024 update. How often do you see some of these regulations changing, and how do you think it's best to approach those changes, especially as it relates to OVForm and what you guys are doing there?
Yeah, I think the best way to keep on top of it is to log in from time to time and keep an eye on your emails, because we do get an email notification of a change. But this one in November, I think it was, I just noticed it. I'd logged in and I saw it. I probably missed the email, but it was such a small change, but it was just worth noting. And then I've shared it with the practices that use OVForm just to let them know. It was a small change, but I didn't want anyone to get caught out if they missed it too.
And this might be a dumb question, so forgive me if it is, but where does the AHPA come into play here? Or were some of the regulations that you were mentioning aligned with the AHPA? Like what is that process? What is their involvement with the AHCs that you're doing? I'm just not entirely clear on it.
So we operate under their authority and DEFRA. I think Rob might correct me, but my understanding is DEFRA communicates with other countries, and the APHA kind of feeds it down to the OVs who are on the ground. We're the official vets that sign the paperwork. So we're meeting the requirements, but we take our guidance from the APHA's instructions.
Yeah, that'd be right. So within DEFRA, and again, this is difficult to comprehend when you don't have any experience of it. But within DEFRA itself, there are different agencies and different groups. So the Veterinary Trade Facilitation, the VTF group, who are vets within DEFRA, will have been involved in writing the certificates. Non-vets within DEFRA, called Market Access, will have then been the people that supplied those export health certificates to the other countries and said, hi, is this acceptable? And then APHA are the sort of supervising group that sees it through in practice. So exactly as you've said, Marianne, they are the ones who are in theory answering the questions. They're the ones supplying the documents, checking them when they go back. If they need to be checked, some obviously are countersigned, others aren't, but they're the ones who are checking those for errors. And Anne Tordoff is the head lady there. Anne has been there for quite some time. Haven't seen her. I was at university with her. I think she was a couple of years younger than me, and I think she's been there for quite a while now. So, but I know that Anne knows it inside out. So if there's any queries, certainly she's the person to go to for the sort of the definitive interpretation.
That helps. Thank you. And how much do you guys predict all of these restrictions kind of staying in place? How much do you predict if they're going to evolve significantly over the next few years, or what to expect there?
That would be interesting. There is a trend. There seems to be fewer OVs generally. They do publish the numbers, and there's been a slight decline over the last year or two since Brexit. I think people are less keen to deal with this. I think this is basically a document saying this pet with this number is vaccinated and it's a non-commercial movement. It's taking 10 pages to do that. And I can really see this becoming unnecessary if we can link the rabies with the microchip number more effectively, so there's less doubt, because at the moment it's like two separate pieces of information. But there is a company working on like a database that like verifies and is secure. But if that became the standard, why would you need all this paperwork if you can verify from the microchip number that the vaccine is valid? You just need an owner to confirm it's non-commercial. So yeah, I can definitely see the potential to change, but the fact is there's 22 states in the EU and they all have to agree. So yeah, I don't know.
That makes sense. And I know you were saying that one of the biggest challenges, or at least what gets most people's forms sent back for revision, are was it putting the microchip number before you get the rabies vaccination?
Yeah, getting your scan dates, if your scan date's after the vaccination date.
Yeah. So that was surprising to me, that between that and the ink part. Which is
one of our biggest like stresses. There was this thread on Facebook about the ink once. It was like everyone was saying, no, it needs to be blue ink, or it just needs to be a different color ink. But it says the notebook guidance actually say now it's pretty straightforward. It was just a bit of sort of mass hysteria at one point.
Yeah. Well, yeah, the best thing that I think you mentioned OVForm doing is kind of in real time telling you if there's anything you're doing that's going to get it sent back. I think that's kind of like when we're doing taxes here, and you'll use like an online software, and before you have, for us, any tax people showing up at your door saying, okay, well, this was wrong, if you go back and correct it. I think that's invaluable and very, very important, especially for really confusing documents that you need to like, or just like really involved documents. But either way, we're coming to the top of the hour. I want to be respectful of everyone's time. I truly appreciate you doing this, Marianne. This was great.
It was my pleasure, Daniel. I hope this helps somebody out there. And if anyone wants to get in touch with me, my email's Marianne, MARYANNE @ovform.com. So
Okay.
I'd be happy to have chats with anyone who needs any help.
I just put that in the chat there. And are you okay with me sharing your LinkedIn perhaps?
Yeah, that's fine.
Okay. Let me put that in the chat as well. I'll put yours and then I'll put mine. Happy to connect with any new folks here. again, we do this every month. We're also starting to do one for the MENA region and have been holding similar conversations just about the intersection between technology and animal health. And we're always excited to have new people on to chat about their expertise or their passion topics. This is my LinkedIn below, and happy to connect with anyone on there. Again, I want to thank you, Marianne. Thank you so much for joining. And I'm looking forward to seeing everyone next time. Again, we're going to have the restream of this available online. You can find it on our YouTube. We'll be posting it on LinkedIn. Yeah, thank you everyone for joining. We appreciate it. Okay.
Thank you. And again, sorry I was late, but thank you very much.
It's nice to meet you, Rob. Have a good.
Thank you. Bye now.
Bye.